Sickle cell anemia, or SCA, is an autosomal recessive disease caused by an A to T mutation that occurs in the 6th codon of the hemoglobin B gene found on human chromosome 11. This is a missense mutation that results in an amino acid change from glutamine to valine and results in a hemoglobin variant that does not function correctly, causing red blood cells to sickle in shape and block capillaries, often causing harm to vital organs. To better understand what a person with SCA might experience on a daily basis, we performed a survey of non-affected people regarding their knowledge of SCA, determined people's responses to being approached by someone they thought might have the disease, and investigated the symptomology and current treatment strategies. Our hypotheses were that non-affected individuals would not know much about the disease, and while wearing the sickle cell anemia shirt, there would be more encounters because of sociological aspects associated with the declaration of having the disease. For the first part of the experiment, a research questionnaire developed by Al-Arayed and Al-Hajari was completed by random participants across the Michigan State University campus. Survey participants were from 3 on-campus housing areas or dormitories: Holmes Hall, Brody Neighborhood, and Case Hall. The data was collected and analyzed, and the results used as a tool to focus on the aspects of SCA that were least familiar to the university student community. Respondents were asked to answer 3 questions. How old are you? With a numerical answer. Have you heard of sickle cell disease? With either yes or no. And to what extent do you agree or disagree that sickle cell disease can impact a child's school performance? This last question was on a scale of 1 to 5, 5 being strongly agree. Asking respondents if they have heard of sickle cell disease was used as a gauge of familiarity with the disease. By doing this survey, we found that the majority of people strongly agreed that SCA does impact a child's school performance, although they have never heard of the sickle cell anemia. This implies that there are sociological aspects other than knowledge about the disease that indicate the severity of not being able to perform in school. We found that the number of people that answered the child performance questions answered strongly agree, or a numerical value of 5, and were 20 years old. The second part of the sociological experiment was to simulate what a patient with sickle cell anemia might experience physically and record different aspects of the experience. A patient experiencing a sickle cell crisis most often will require admission to the hospital, and to better understand what a patient might medically experience, a group member interviewed Dr. Sarah Elke-Bachek, a pediatrician affiliated with Bronson Methodist Hospital in Kalamazoo, Michigan, about the procedures taken to treat a person experiencing a sickle cell crisis. Part of the experience patients with sickle cell anemia undergo during a sickle cell crisis is also psychological, involving experiences with medical personnel and the hospital in which they are treated. Because of this, one group member also walked through the hospital with Dr. Elke-Bachek to try to achieve a better understanding of what a patient might experience. From the hospital walkthrough and physician interview, it was determined that upon arriving at the hospital, the patient would initially be triaged and comfort measures would be provided, as pain is one of the most common symptoms of a sickle cell crisis. The patient would be placed in a wheelchair and moved to an examination room. After entering the examination room, vital signs including blood pressure, heart rate, respiratory rate, blood oxygen saturation, and weight would be obtained at the same time. A history would be taken. Oxygen and pain medication would be administered if needed. Physical examination would be performed, and blood would then be drawn for analysis by the hospital laboratory. 1 or more IV lines would be started, and intravenous fluids administered. Pain medications could also be given through the IV. The patient most likely would be taken to radiology for a chest x-ray to help determine how the lungs are being affected by the crisis. Based on these findings, the doctor would prescribe a course of treatment utilizing various drugs, including antibiotics and pain medications, oxygen, and IV fluids. The patient would be closely monitored. It is clear that individuals with sickle cell anemia admitted to the hospital will face a variety of physical and psychological challenges, including stress, pain, and time-consuming procedures, which will interfere with the daily living and can be financially demanding as well. To begin to understand the psychological and physical demands of this disease, procedures were utilized to mimic an unexpected sickle cell crisis, a common complication of sickle cell anemia. A small electric dog collar was worn by a group member who was then shocked at random times while performing different activities. The shock pattern was meant to indicate different symptoms. One shock represented the symptom of fatigue, while two shocks represented the onset of pain attacks. To eliminate bias, the individual wearing the collar was not aware of how many shocks would be administered at one time. Data was then collected by the individual wearing the shock collar. This data included date and time of shock, number of shocks, what the individual was doing, if the shock or shocks interfered with the individual's activity at that time, and how the individual felt at the particular time of shock. In total, the individual wearing the shock collar experienced 41 shocks throughout 1 week. 24 or 59% were administered as one shock at a time, and 17 or 41% were administered as two shocks at a time. Morning and evening were categorical choices when recording the time of the shock. Of the 41 shocks, 14 occurred in the morning while 27 occurred in the evening. Some of the activities that occurred while the individual was shocked included attending class, doing homework, interacting with friends, walking on campus, sleeping, and eating. We found that many of the shocks would interfere with everyday activities such as walking and attending class. The third and final part of the experiment consisted of determining how the public viewed people with SCA. To simulate what individuals with SCA might experience in terms of public reaction to their condition, group members wearing shirts that stated, "I have sickle cell anemia," or "I went to summer camp," and to try to interact with individuals in a public setting. The "I went to summer camp" shirt served as a control to differentiate an initial reaction from the t-shirt design. 2 males and 2 females wore the shirts for 1/2-hour period each at various locations, including those on the Michigan State University campus, which include IM Sports East and McDonald Hall in East Lansing, and those off campus, including Meridian Mall in Okemos, Michigan, and the D&W grocery store parking lot in Portage, Michigan. To measure the response towards each shirt, pamphlets containing information on sickle cell anemia were provided to people passing by. A total of 74 people either walked by or approached the individuals while wearing the sickle cell anemia shirt. 24 of the 74 people walked by, meaning they ignored the people with the shirts. A total of 77 people walked by or approached the individuals wearing a summer camp shirt. Overall, 39 of the total 77 people walked by and ignored the individuals. A chi-squared test of independence was run for each member's separate collected data. A p-value of less than .05 indicated that the number of people who walked by was dependent on the shirt that the member was wearing. In conclusion, from our experiment, we believe that our hypotheses were correct and that while wearing the sickle cell anemia shirt, there were more encounters because of sociological aspects associated with declaration of having the disease. Also, it is clear that people with the disease face substantial and debilitating physical and psychological challenges.